A renowned gynaecologist and fistula specialist, Dr. Naa Barnabas Gandau, is advocating for intensified community engagement to reduce the stigma against fistula patients and survivors. He emphasizes that reintegrating affected women into society must involve active participation from health professionals, especially within faith communities, to eliminate discrimination in places such as churches and mosques.
Fati, Fatima and Abibata are residents of Dabozesi in the Mamprugu Moagduri District and are among several women who have suffered physiological trauma, social rejection and isolation for over 20 years. Their condition causes them to involuntarily urinate on themselves, often producing a foul smell, a consequence of obstetric fistula, typically resulting from prolonged or obstructed labor. The stigma has severely impacted their economic lives. Despite being active farmers, they are unable to sell their produce at local markets due to name-calling and exclusion from communal activities. I was pregnant and went through prolonged labor. I had to be operated on, but I lost the child. After the surgery, I started urinating on myself without knowing. When I returned home, my husband and family couldn't accept my condition, so I had to leave my marriage. I stopped attending social gatherings because of the smell. I chose isolation to avoid being mocked. Even though I still farm, no one wants to buy my produce. I was pregnant with twins. I delivered one at home before being rushed to the Stigma hospital, but I lost both babies. Afterwards, I began urinating involuntarily. People started calling me Wee Queen. My husband supports me, but I can't bear intimacy anymore. The urine leaks without warning, and the name calling was too much. That is why I live alone now. Salamata, a 78-year-old blind woman who lives with the condition, told Noah Nash that she had forgotten about the stigma of the condition after she got her daughter's support before going blind. She revealed that her only child is her source of joy as a blind woman with a fistula. Meanwhile, the Queen Mother of Dabozesi, Aisha Mohammed, says the high cost of fistula treatment is a major reason why many women remain untreated and isolated.
These are women after getting that condition, they are stigmatized and they are relegated to the background by their husbands, sometimes their family members, sometimes even their children get tired of them. But because of the money involved, they just prefer to be there. They just prefer to remain in the background, to be relegated, they prefer to be facing the stigmatization and everything because of the money involved.
She further lamented the lack of a health facility in the community, which worsens the situation and prevents early medical intervention.
Because still, in this community, we don't have a clinic. The Dabozesi community has no cheap compound, not even talk of a clinic. Still, in this community or in the neighboring communities, we still have women who give birth and lose their babies and still fall in the fistula, obstetric fistula arena or zone. They still fall into it. You can neither blame the people nor blame them. Nor blame them, the obstetric fistula patients. You can neither blame those that are stigmatizing them nor they themselves.
Dr. Naa Barnabas Gandau insists that stigma reduction efforts must go beyond surgery and include community education, faith-based support, and visible endorsement of survivors by trusted figures in healthcare and religion.
The only way people get to know that this person has been treated, do you know where? In the church, in the mosque, in the market. If once I was smelling urine and feces, and I'm healed, have been trained in a trade to sell soap, to sell kebab, to sell bull fruit, to sell this. Train them. Send them to the community. Sit down with the fistula patient, eat with her. The whole community will understand that, yes, they've been fixed. They are no longer smelling urine. They go to the mosque and pray. Everybody will understand them. But they say, oh, I've fixed your prayer, now go back home. She will still go into hiding. Well, nobody believes her. Not even the family, not even the husband, not even the children. That is it.